All right, we talked about building a list earlier on, right? So, who are your lists? How do you get your list? Number one, part of your list is your current referral source, right? If you have people that are already referring patients to you, then they should be primarily in the top of your list. Okay, these are people you should always be following up on, right? Don't follow up with them just because you have a problem with a patient. Follow up with them just to say hi, to drop off some chocolates, to drop off a cookie, whatever you need to do. Drop them off a comic strip of the week, whatever you need to do. And this is how we teach people on the follow up process. There's the cold follow up process and there's the hot follow up process. All right, number two, patients being served. When you have patients already right now, your current clients, they should be followed up in your list. They shouldn't be just followed up by whom? By the clinicians, the nurses, the CNAs, the homemakers, the caregivers. No, shouldn't be the only primary people contacting them. If you were a marketer, if you were a liaison, and you got that client on board with your facility, guess what? You should be following up with that patient. Make sure they're happy, especially if they're a non-medical patient and they are one of those non-medical where it's 24 hours a day or they have more than 12 hours a day per, for assistance, where that's a gold mine. You better make sure that that person sticks around with your company, and you want to be that rock star person. So, you know, always make sure that we take care of our current clients, referral sources, and patients, or people that we're servicing pretty much. Lost referral sources. Have you ever had those referral sources that used to refer patients to you or refer clients to you, then all of a sudden they just stopped? Right? And then you need to be able to know if a prospect, a person who's referring patients to you, was referring, let's say, 5 a month to you or 10 a month to you, then all of a sudden a month later they're not referring to you anymore or it decreased. You need to be able to have a red flag with that and to be able to tell yourself what's going on. Let's see what we can do. Let's follow up with them. Those are very important to have. But if you already lost a referral source, it's a lot easier to get them to come back to you than to get a new client. Okay? Just because you messed up once, people make mistakes. It's okay. But what you need to do is you need to learn how to be able to not lose them. Okay? And so that's where follow-up is very, very important. Unsold sources. Let's say, for example, you made a cold call, you made a cold introduction, or you've already dealt with and had a presentation to someone and they never really return your call or never even referred a patient to you, even though they promised that they were going to refer patients to you. Well, those are what we call unsold sources. Okay, you already warmed things up already, so you need to be at there constantly getting them information, finding out details, right? You already warmed things up. It's a lot, they're closer than the company or than the person that you're just about to meet or just about to have that initial introduction to. Referrals, right? Same thing. Those are pretty much the same thing as your patients. Okay. List sources. All right. There's companies out there that you can call to be able to have them help you get a list of physicians in your area. Okay. And you can literally, even get them to get you their emails. Those, there's some lists that you can get those where you actually have to purchase the list. And most of the time it's like you're spending around 20 cents per physician or 20, depending on what the demographics are and how you want to narrow things down. If you want a list of your physicians, their MPI numbers, one of the biggest suggestions I have is purchase the little blue book or the little yellow book. But the blue book is better. So look it up in Google, blue book, the little blue book, physicians NPI. And you're going to actually have a company that will sell you that book that has all the NPI numbers, the contact information for certain physicians, what their specialties are. Very, very good book to use. You can also download their information online. I believe they have an app, if I'm correct, as well. So very good source for information. You can use, Medicare.gov to be able to find nursing homes in your area, hospice companies, physicians as well. Very good information. And it's for free rather than you paying another company. Next thing is social media. LinkedIn, guys. LinkedIn is the Facebook of finding information about people. who they're working with, what their positions are. You want to be able to use LinkedIn. If you're not in LinkedIn yet, I truly suggest that you guys get it cracking and join it.